My name is Tana, and I'm a resource consultant at Lansdowne Children's Center. Today, I'm going to talk to you about communication skills. Communication can be defined as the act of using words, sounds, and behaviors to express or exchange information or to express your ideas, thoughts, feelings to somebody else. Communication can be broken down into different skills: receptive communication skills and expressive communication skills. Receptive communication is the ability to receive and understand messages from another person. Babies can demonstrate this skill by reacting and turning their heads towards a voice. They may respond by vocalizing sounds. As children's receptive skills develop, they will continue to respond to their name, follow directions, and have flowing conversations as they understand what you are expressing to them. Expressive language can be defined as the ability to convey a message to another person through sound, speech, signs, and writing. Crying, babbling, and body language are some ways infants demonstrate expressive language communication. This will then develop into full words, sentences mixed with body language as the child gets older. Just like any other developmental skill, communication has its own milestones as well. These milestones begin right from birth and especially during infancy. A child's communication skills may progress quickly. As stated previously, around 0 to 3 months mark, infants will make cooing noises or cries as a way to express themselves. Around the 4 to 6 month mark, infants will not be forming words yet, but they will begin to react more to your communication, such as looking at you, following your voice. The constant sounds infants make from 4 to 9 months will be the beginning steps of being able to form words. At 10 to 12 month mark, your baby may now begin to use a small, simple, but meaningful word such as mama or dada. This will continue to be used in partnership with their body language. As a child approaches the toddler age, you should begin to hear the child's vocabulary growing. They will have a wide range of words, along with trying to imitate what you and others around them are saying. At this point, they will understand a lot more as well and may be able to answer some basic questions. By a toddler's second birthday, they should begin to use 2 phrases, follow directions, and demonstrate an interest in listening to songs and stories. Although these are average milestones for children, it's important to remember every child develops differently and not all communications look the same. Although verbal communication is the most common, a child may benefit from nonverbal forms of communication. These may begin with simple signs for things like all done, more, please, etc. Educators and families may begin to teach these signs to young children while also repeating the words with the signs so that the child has a better chance of being successful in communicating. Some children have demonstrated to use sign before attempting to use some words. As the child's communication skills progress, they may be expected to use verbal communications over signs as long as they are capable of doing so. Other children may depend on signs for a larger part of their life, especially those with hearing impairments or other delays. Another form of communication that is seen is picture exchange communication. This is generally used for older children around the preschool age and up. The child may have a book of pictures that best suits their needs and wants, such as their favorite toy, snack, activity, or everyday routines they may participate in. This is seen as a valid form of communication as the child hands the educator or parent a picture of what they are requesting. Some children may be able to approximate words as they use the pictures. With technology developing so quickly, these pictures may also be able to be put on a device such as an iPad for children to communicate with everyone around them. Communication is a very big part of our lives. It helps to develop healthy relationships and the way of sharing and explaining our emotions, expressing our wants and our needs. It is the way we learn new things and even teach new things to others. Although it may not look the same for everyone, it is important to understand the different forms of communication and the development of the children in your care. If you have concerns about your child's communication skills, it is best to speak with a professional, as an intervention may be needed with a speech-language pathologist. This will allow the therapist to find the best effective way to help a child learn to communicate. Thank you.
A resource consultant from the Early Integration Program is available to talk to you should you want more information, support, or to discuss any concerns or questions you may have. Please contact us by email at eip@lansdowncc.com or by phone at 519-753-3153. Ask reception if you can speak to a resource consultant.